contents in the online media. So it produces screen addiction in the society. അതിൻ്റെ ഭാഗമായിട്ട് സൂയിസൈഡ് വന്നിട്ടുള്ള കേസുകൾ നമുക്ക് റിപ്പോർട്ട് ചെയ്തിട്ടുണ്ട്. ആൻഡ് ആൾസോ pornography addiction especially among the adolescents pornography addiction ഉണ്ടായിട്ടുണ്ട്. അതിൻ്റെ ഒരു ഇമ്പാക്റ്റും വരുന്നുണ്ട്, റിപ്പോർട്ടഡ് കേസുകൾ വരുന്നുണ്ട്. Then adolescent suicide are increasing. The media report that adolescent suicide are increasing. Government have constituted a committee for studying the child suicide as well as the for advocating a policy for containing the child suicide. I am also a member of that particular committee. Then children with the special needs, especially autism, cerebral palsy, then intellectual disability, ADHD, all these children with the special needs. So they are having hospital-based therapy and school-based therapy. All these therapy are disrupted across the world. It is a problem. Therapy is disrupted. The people are actually, therapy is actually a close intervention. Close intervention means the child, direct intervention between the therapist and the child. Now in the COVID pandemic, this social close intervention is not possible. So we have changed it to online as well as video based therapy. So that actually it won't be equal to the cannot be equalized with the direct therapy. So naturally the quality of the therapy will be affected. And poor online classes content for the children with the special needs, even though the other school children are getting the online education, good quality online education, but the children with the special needs they are not getting. Then antenatal stress, another section of the society. There is disrupted antenatal checkup in the hospital. Recently we have reported a case that child died in the antenatal period due to the care from the hospital, and they are not ready to receive the case due to the COVID positivity. Then problems in the antenatal care and fear of chance of getting infection to the other people. Then also the fear of spread of infection to the fetus and the newborn. So this is a problem in the antenatal period. Now old age stress. At-risk group is the old age group is an at-risk group. They will have increased incidence of lifestyle disease. They are having increased morbidity and mortality. Because suppose they get COVID positivity, the complications will be more because the majority will be having lifestyle disease. So the complications will be more. So it will affect the mortality. നമ്മളുടെ ഡെത്ത് റേറ്റ് നോക്കുമ്പോഴും കൂടുതൽ ഒരു 70% are due to the old age death. 70% death are from the old age population. Then they will have dementia. Suppose a dementia person is getting COVID infection, it will be very horrible. The problem for the people, for the relatives, the management of the patient will be very difficult. Then psychiatric morbidity will be more among the elderly people. So it will also create problem. So for the old age people, it creates a lot of increased morbidity and mortality. Now the problem is that even though they are keeping in the house, the young population is moving in the society. They will get the infection, but they will not have the disease symptoms. But they will act as silent carriers and they will spread the infection to the senior members in the family, and the senior members will be affected, and there will be increased morbidity and mortality due to the other factors I mentioned. Mental illness, especially a section of the society, people are having mental illness. The treatment of the ongoing mental illness will be disrupted because of the availability of the drugs and availability of the psychiatrists and the direct consultation are affected. So the treatment disruption in the mental illness area. availability of the drugs, then vulnerability to precipitate exacerbation. They will have, suppose they are in the remission phase, they will get exacerbations due to the stress is increasing in the family as well as in the society. So naturally, they will have poor psychological resilience. So the events, suppose a bipolar illness, it is symptom-free period. There is a chance that the bipolar symptoms can be exacerbated. It is also it is anxiety and depression also. People having anxiety and depression also they will get the precipitation of the symptoms. It can because they are having poor psychological resilience. Alcohol and drug abuse. So alcohol withdrawal is a very complication, severe complication. The way people can go for delirium tremens. Recently, we have പ്രഖ്യാപിച്ച ഘട്ടത്തിൽ ബാറുകൾ അടഞ്ഞു കിടന്ന ഘട്ടത്തിൽ ആൾക്കാർ മദ്യം കിട്ടാതെ മരിച്ചുപോയ മദ്യം കിട്ടാതെ വന്ന് സൂയിസൈഡ് ചെയ്ത സംഭവങ്ങൾ നമ്മൾ പത്രത്തിൽ വായിച്ചതാണ്. So drug abuse, depression and suicide are actually a triad. People having drug abuse or alcoholism, they will have depression and they will commit suicide. So it is a triad of alcohol abuse or drug abuse, depression and suicide. Now, stress among the frontline workers. Frontline workers are the healthcare workers, starting from ASHA workers to doctors in the medical college. So there is a section of people, healthcare workers are affected. Daily, at least 100 people or more than 100 people are affected due to the affected in the healthcare area. The police force also affected due to the close contact with the people. Other supporting staff in the various sections of the various sectors. So they are having actually overburdened duty, risk of infection will be more, chance of spread to family members, that is the risk is very more, and they are having psychological stress. So different studies have conducted, assessed the psychological stress among the frontline workers. Different studies have assessed this problem, and the prevalence of high level stress was among 3.7%, depression among the frontline workers 11.4%, and anxiety among 17.7%. This study was published in Indian Journal of Psychological Medicine in last month, 2020. Now, psychological impact. What is the fourth point? Is what is the psychological impact? We will discuss the psychological impact on the children and adolescents in detail, and as well as the other adult population. So, children and adolescents, not all children will be affected. So, continued media reports. Actually, the children are also observing the continued media report. We have to approach the problem in the developmental perspective. The small children, especially 0 to 6 years, they will have I already mentioned, they will have bottled emotions. They cannot express their emotions. Even though they are affected, they cannot express their emotions. So that will be reflected in their behavior. So they will go for regression. Regression means moving to their previous developmental states. Regression and the clinging behavior, disturbed sleep, irritability, anger, hyperactivity. They will not sit quietly, and they will become problematic to the parent. Hyperactivity. They may start fearful dreams, nightmare, and intrusive fearful thoughts. They will show. So this is the with regard to the old, smaller children. Now, with regard to the older children, 6 to 12 years, they will have some understanding of the situation. So naturally, they will have pervasive sadness. Recently, I had seen a case, a child, an 11-year-old boy was brought to me with the history of repeated episodes of fear that his parents may die. രണ്ടുപേരും വർക്കിംഗ് പേരൻസ് ആണ്. അപ്പോൾ അവർ രണ്ടുപേരും പുറത്തു പോകുന്നു. So the child is having the fear that the parents may die and he will be left alone. So that is the frequent thoughts and frequent fears, and the child was brought to the behavioral pediatrics unit. Yesterday, I have seen a case that he was about 8-year-old. 8-year-old boy. He is having continuous watery diarrhea. Whenever he is in the house, he will have this continuous diarrhea. When he is admitted in the hospital, he doesn't have any problem. So when a detailed psychological evaluation was done, then the child told that he is having the problem, he is having the loneliness, and nobody is there to play with the child. So that is he is the only child. So that is a problem. Then fear of loss of both parents, fear that world will end, the sleeplessness and aches and pains. That is the somatic symptoms. Child will present with the somatic symptoms. Psychological stress will be transformed into somatic symptoms. Actually, the adolescents are more affected. They will have isolated feeling of isolation, losing contact with the peers, because the school is closed, and fear of loss of stability and security from the parents. The parents are not addressing to their problem, and they will have concern about education and future, because the various courses there it is not started, the classes are not started, the school is remaining closed, so they are more worried about their future. They will have a problem like chronic fatigue and adolescent suicide. Actually, there is increased reports of increased rates of adolescent suicide, especially during the COVID pandemic. Now, psychological impact on adults. The different studies have conducted on the psychological impact of among adults. Every 1/5 respondent reported stress, and 2.7% had reported severe stress. In a Tamil Nadu-based study, again it was published in the Indian Journal of Psychological Medicine in the current month. Okay, so all are not having the disorders, but they will be in stress. They cannot call it as disorders, but they will be in stress. So it is a systemic, total effect, lockdown, occupation crisis, financial crisis, all this will be affected. Schools remain closed, then lot of standstill in the family life, lot of problems in the family. So it is a system effect, and they will present with inattention, irritability, anger, fear, anxiety, sleepy. Some will have sleepiness, loss of appetite. Feeling of helplessness, hopelessness, worthlessness, then suicidal wishes, suicidal attempt, violence will be generated among the people, especially I already mentioned about the families having dysfunctional family. It is alcoholism, violence, and quarrelsome events. The quarrelsome events will be precipitated because all are sitting in the house without going outside. Domestic violence will be precipitated in the relationship, in the husband-wife relationship, and the precipitation or exacerbation of the psychiatric illness will be happen. Naturally, the psychological stress will be more, because the psychological vulnerability will be more for the patients with the mental illness. So, precipitation of the exacerbation of the psychiatric illness will be Then mental health disorders. Now, certain mental health disorders are also reported by the various studies among the people in the society in the COVID pandemic context. So, anxiety and related anxiety spectrum disorders, especially post-traumatic stress disorder, panic attacks, then obsessive compulsive disorder. This is very important and complicated affair, because we advocate for repeated hand wash. So So the people having obsessive trait or the controlled obsessive compulsive disorder, the illness will be precipitated. So this is a hot topic, especially those are having obsessive compulsive disorder or treated controlled obsessive compulsive disorder people. Now the problem is that this obsessive trait will be precipitated because of the repeated hand wash and repeated this affair. Then depression. The people having depression, the precipitation of the depression can occur under psychological vulnerability, genetic vulnerability. People, there is a chance of developing depression. Post-traumatic stress disorder, I already mentioned. And precipitation of the, I already mentioned about the precipitation of the existing psychiatric illness and suicide. Suicide, especially those having depression. So I will mention about the warning signs of suicide. Society should be aware of. So certain warning signs of suicide I will be mentioning. The adults usually they will mention these warning signs, but the children they will not express their warning signs. They will act, but people will find it very difficult to identify the warning signs among the children. But in adults, it will be definitely. Suppose you want, you can definitely observe in your relationship, in your close relatives. Like they will express hopelessness, then helplessness, express worthlessness, then suicidal wishes. മരിച്ചു കളഞ്ഞാൽ മതി എന്നുള്ള തോന്നലുകൾ ഏറ്റവും ക്ലോസ് ആയിട്ടുള്ള റിലേറ്റീവ്സിന്റെ കൂടെ they will express. And the feeling of emptiness, ശൂന്യത വരും തോന്നുന്നു എന്നുള്ള രീതിയിലുള്ള മാനസികമായിട്ടുള്ള വിഷമം പ്രകടിപ്പിക്കും. ഇതെല്ലാം ക്ലോസ് ഇന്റിമേറ്റ് റിലേഷൻഷിപ്പിലാണെന്നുണ്ടെങ്കിൽ we can definitely observe, otherwise it will not be observed and it will be left, and the end result will be the suicide. And the final point is the approach to intervention. Approach to intervention, that is under the three headings we can discuss the intervention. Universal intervention, general intervention, then selective intervention for selected people, especially the frontline workers, or other different sections of the society who are having problem but not disorder. And the clinical intervention for those having the disorder. Now, universal intervention to children, how we can do some general measures to the children, family at the family level. Again, we have to approach in a developmental perspective manner. Different children should be treated in different angles. The smaller children, we have to create emotional warmth. We have to interact with the child. We have to model the calm. So, when though we are having stress, we should not express this stress or tension in front of the child. The family members should be aware of this. So we should model in the calm. And we have to spend time with the child, fix a time daily with the child. So we should play with the child. ഞാൻ നേരത്തെ പറഞ്ഞ ലോൺലിനെസ് ഉള്ള കുട്ടി എന്ന് പറഞ്ഞിട്ട് ആ കുട്ടിയുടെ വീട്ടിലെ അച്ഛൻ ഈസ് എ സോഫ്റ്റ്വെയർ എഞ്ചിനീയർ. ഇപ്പം ഹോം ബേസ്ഡ് വർക്കാണ് നടക്കുന്നത്. പക്ഷേ പുള്ളി വീട്ടിൽ ഇരിക്കുന്നുണ്ടെങ്കിൽ ഒരിത്തിരി സമയം പോലും ഈസ് നോട്ട് സ്പെൻഡിങ് വിത്ത് ദ ചൈൽഡ്. സോ ചൈൽഡ് ഈസ് ഹാവിങ് ലോൺലിനെസ്. അത് നമ്മൾ പാടില്ല. സോ വി ഷുഡ് ട്രൈ ടു interact with the child for fixed time daily with the child. So play with the child, some interesting activity to the child. We should try to find time and focus on indoor games, skipping പോലുള്ള ഗെയിമുകളൊക്കെ and speak about home life and children. Family situations-നെ കുറിച്ച് നമ്മളിപ്പം കോവിഡ് പാൻഡമിക്കിനെ കുറിച്ചിട്ടുള്ള ഡിസ്കഷൻ ഫാമിലി ലൈഫിലുള്ള കാര്യങ്ങളെ കുറിച്ചിട്ടുള്ള അതൊരു we have to stick on the family matters and limited media exposure. അതാണ് smaller children. Older children ആകുമ്പോഴത്തേക്ക് they will be more aware of the situation. So they are seeing the media exposure is there. medium exposure to media should be good. Is advice. And the ventilation, we should try to discuss with the child. We should, what the suffering of the child, what is their current awareness regarding the COVID pandemic, what is their the concerns. So we can discuss with the children, older children. And quality time spent. So here also we should focus on indoor games. We should try to develop indoor games, various indoor games. If it is a home environment, we can play the shuttle, we can do some simple ball game or skipping. So we should try to find out some indoor games. We should try to focus on extracurricular skill of the child. So child will be having a bit skill of singing or drawing, acting. ഏതാണെന്ന് വെച്ചാൽ പുള്ളിക്കുള്ള ഇഷ്ടമുള്ള ഏത് കാര്യം എന്ന് വെച്ച് കഴിഞ്ഞാൽ വി ഷുഡ് എൻകറേജ് ദ പെർഫോമൻസ് കരിക്കുലർ സ്കില്ല് എക്സ്ട്രാ കരിക്കുലർ സ്കില്ല് പ്രകടിപ്പിക്കുന്നതിനും അത് ചെയ്യുന്നതിനുള്ള കുട്ടിക്ക് കൂടെ ചേർന്ന് നമ്മളും കൂടെ ചേർന്ന് പാടുക. അങ്ങനെ നമ്മൾ കുട്ടിയെ എൻഗേജ് ചെയ്യിക്കാനായിട്ട് നമ്മളൊരു ഫിക്സഡ് ടൈം ഡെയിലി നമ്മൾ കണ്ടെത്തിയത് കുട്ടികളുമായിട്ട് ചെയ്യുന്നതിന് വേണ്ടി ശ്രമിക്കണം. അഡോളസൻസിൽ നമ്മൾ അവർക്കൊരു നേരത്തെ ഞാൻ പറഞ്ഞത് ഫിയർ കൺസേൺ അബൌട്ട് ദ ഫ്യൂച്ചർ. സോ വി ഷുഡ് ഡിസ്കസ് ദ തിങ്സ് വിൽ ചേഞ്ച്. ഇപ്പൊ ഇത് ഈ വർഷം നമ്മൾ we can discuss about the previous episodes. The Spanish was in early part of the 20th century, 1978 and 79. It was in India. So Asian things have changed. So maybe it is an yearly affair. We should discuss with the child, and we can ask the child to refer the various aspects in the Google and find out how the things will change, and we can plan the future within the period itself. We can plan for the future and encourage the extracurricular skill and performance, as I mentioned. കുട്ടിക്ക് കഴിവുകളെല്ലാം പ്രകടിപ്പിക്കുന്നതിന് അതിനെ പ്രോത്സാഹിപ്പിക്കുന്നതിന് വേണ്ടി നമ്മൾ ശ്രമിക്കണം. And we should try to spend some quality time with the adolescents. Adolescents ആയിട്ട് ക്വാളിറ്റി ടൈം സ്പെൻഡ് ചെയ്യുന്നതെന്ന് പറയുമ്പോൾ അവർക്ക് ഇഷ്ടമുള്ള ടോപ്പിക്ക് അവരുമായിട്ട് ഡിസ്കസ് ചെയ്താലേ അവർ ഇരിക്കും. നമുക്ക് ഇഷ്ടമുള്ള ടോപ്പിക്ക് നമ്മൾ ഡിസ്കസ് ചെയ്താൽ അവരിരിക്കും. സോ quality time spending very important with the adolescents also. We can also focus on the indoor game and the regulated online activity. നമ്മൾ മൊബൈലൊക്കെ കൊടുക്കും, പേരൻസ് കൊടുക്കുമ്പോഴത്തേക്ക് അല്ലെങ്കിൽ അവർക്ക് കാണുമ്പോൾ അവർ നേരം ഓൺലൈൻ ആക്ടിവിറ്റിയിലിരിക്കുന്നത് അവരെ ഡിസ്കറേജ് ചെയ്ത് അല്ലാതുള്ള ഫിസിക്കൽ ആക്ടിവിറ്റിയിലോട്ട് കൊണ്ടുവരാനാണ് ശ്രമിക്കുന്നത്. Now school level intervention. Some points, some